Good morning. I'm Carrie Ann Scanlon. I'm the Executive Director for Glen Cove Hospital, part of Northwell Health. And we're so honored and happy to be here today to speak to you about a wonderful program and initiatives that we've been partaking to improve the care of our aging within our community. We have some wonderful guests in our agenda to speak to you and leaders throughout Northwell Health and also from our community. And we have a patient story at the end, and we're very honored that our patient and his wife will be speaking to us today about their experience that the health system has made to the aging community. It is one that is truly remarkable. It is one that our CEO, Michael Dowling, has had full commitment to, and we are very honored that Dr. Maria Carney has championed this through the years. It is something that we are attaining, and it is something that we strive for full commitment across our continuum of care. So, without further ado, I'm going to introduce our first speaker, and it's a privilege to introduce him. He is our Regional Executive Director for the Eastern Region, which Glen Cove Hospital is part of, and he is our Senior Vice President for Northwell Health. He's going to be speaking with you today and provide some welcome and also some points around the actual program that we have announced at Northwell Health. Steve Bello.
Thanks, Carrie. I'd like to join Carrie in welcoming all the attendees for today's event. And I'd like to congratulate Northwell Health on being recognized as a age-friendly health. Tracy Fulmer from the John A. Hartford organization. A couple other special congratulations. One is to Dr. Maria Carney, who you're going to hear speak later. Dr. Carney is a wonderful physician, a champion in the clinical work she does for the aging population. And really a leader in this field, and we feel blessed as part of Northwell Health to have her as part of our faculty and a leader in this. I'd also like to congratulate Carrie Scanlon and the team at Glen Cove, who've done phenomenal work in pushing the clinical programs and the competencies and everything necessary to designate Glen Cove as a recognized center for the aging as well. I think it's an interesting time right now in healthcare as we look at what's going on with the COVID pandemic. You look at Northwell's response in the COVID pandemic, and you think about today and our ability to kind of sidestep what's going on in the national media and talk about a program that we think is going to have an impact on the broader community of Long Island, the metro area, and specifically in Glen Cove. You know, as Michael Dowling continues to emphasize, while we meet the challenges of the COVID pandemic head on, we have work to do outside of COVID. And I think this program is a great illustration of what Northwell is working on to help change the care for the communities that we serve. You know, there's a couple facts that we all need to accept. The first is over the next 30 years, the population in the United States over the age of 65 is going to double to about 84 million people. That's a fact. With age also comes different challenges, medical challenges, social challenges, challenges for caregivers, and challenges for the communities in which they treat the elderly population. The aging population has unique challenges, and we are committed as Northwell to address these challenges. These challenges may include physical assets such as our buildings, our parking lots, other areas where people choose to access our institutions, the training and competency of clinical and non-clinical staff, and really our partnership with the community in being able to form collaborative, seamless transitions of care for the aging population. So whether they're in their community or whether they're in the hospital, that they have access to all the facilities that they would need. So Northwell is committed to addressing all these challenges and those that we haven't seen yet. We're going to address these challenges by focusing on the 4 M's, which are medication, mentation, mobility, and what matters most. All of these issues are key to developing programs that specifically address the needs of the aging population. We're going to address these 4 M's through a series of processes. First off is our teaching, our academics, our research led by Dr. Carney in creating the physicians of the future and training our current physicians on the unique aspects of care for the aging population. There's clearly going to be a need for resources, and Northwell's committed to providing those resources for this population as well. And then ultimately, we look forward to helping design and implement different programs, treatments specific to the aging population that will make an impact in care. And one of those just that I was part of in the past that I speak highly about is what we've done for hip fractures within our population. Dr. Carney spearheaded a team that treated hip fractures in the aging population very, very differently than in the past. Has much less to do about the operation than it does about the care afterwards. And finally, we have other initiatives that we're working on, whether it's fall prevention, whether it's dementia care, or whether, again, it's partnering with community-based organizations within our broader communities to help ease the transitions of care. The one comment I want to make that's a little bit different than the traditional care models is our caregiver centers, our focus on caregivers. We focus a lot about the patient, but as you'll hear later on, the caregivers have a tremendous role in the care of the elderly and in our healthcare community overall. We at Northwell have stood up 4 caregiver sites within our hospitals, one at Northern Westchester, one at North Shore University Hospital, another in Peconic Bay Hospital in Riverhead, and now one at Glen Cove. And these caregiver centers are really focused on providing support and community-based resources to the caregivers who often feel the burden at times of taking care of the ones that they love. So in conclusion, Northwell is committed to pushing forward advances for the treatment of the aging population in every way possible. And the way Northwell has always done things is by leading through innovation, leading through research, leading through academics, and we plan to do the same here. Glen Cove is a very lucky community, very lucky to have the support of an excellent administrative team, and very lucky to have the support of Congressman Suozzi, who has been a relentless supporter of healthcare in the Glen Cove community and across Long Island and in the nation. We're proud of that support. So I'll hand it back to Kerry now, but thank you for your time.
Steve, thank you so much for that exciting announcement. Steve is a consummate professional and leader who is passionate about ensuring that we have what we need to make these programs happen within our institutions and outside of the walls of our institutions, crossing across the continuum of care. The other thing that Steve mentioned, which I'm so glad he mentioned, was our caregiver centers, because, again, he is someone that fully supports and is able to provide for resources so that these things actually do occur. So, Steve, thank you so much for your leadership. Our next speaker is a woman who I met a number of years when she came to North Shore University Hospital and our health system. She is an individual that, from the moment I met her and the excitement in her eyes on how we're going to improve the care of our aging, what are we going to do to support the staff in providing that care? And third, what are we going to do to support the families and the loved ones that actually have the honor and dignity to support individuals, particularly with advanced illness? She is the chief of our geriatric and palliative care programs across Northwell Health, and she's the medical director for the post-acute care services for Northwell Health. It's a privilege to introduce Dr. Maria Carney.
Thank you, Carrie. Thank you for your commitment to Northwell Health, Glen Cove Hospital, and the communities it serves. It's an honor to be here with you, Congressman Suozzi, Stephen Bello, Dr. Mate of IHI, and Terry Fulmer of the John A. Hartford Foundation to announce Northwell's commitment to high-quality care for older adults through its partnership with the Age-Friendly Health System Initiative. COVID, as has been stated, has underscored the importance of social and caregiving support on health and health care outcomes. Furthermore, how we age, access care, and live in our older adult years has been highlighted and may forever be changed because of COVID-19. These are incredibly unique times, and this is why today is a very important day. Hubert Humphrey, upon dedication of the Health and Human Service building in Washington, D.C., in 1977, in this month in 1977, 43 years ago, stated, "The moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, those who are in the shadows of life, the sick, the needy, and the handicapped." I say this quote because it's been more than 10 years since Congressman Suozzi and I first spoke of the need for a health system and hospital to lead in promoting the importance and impact of high-quality care in healthcare delivery for older adults in our region. We each had personal stories and experiences. We understand the community, its demographics, and the challenges the region faces. So I'm extremely pleased to be standing here with Northwell leadership and Congressman Suozzi to share some news. In alignment with the Age-Friendly Health System Initiative and with the goal of leading it, I am pleased to announce that Glen Cove Hospital is Northwell's Geriatric Center of Excellence. Over the past few years, we have focused on several initiatives at Glen Cove Hospital that build upon the 4 M's of being an age-friendly hospital: mobility, medications, mentation, and what matters most. With Congressman Suozzi's advocacy, Carrie Scanlon's leadership, and the support of leadership like Michael Dowling and Stephen Bello at Northwell Health and the Zucker School of Medicine, the hospital's journey began with the acute rehabilitation by our physical medicine and rehab leaders, focusing on a person's function and mobility. Next came the caregiver support program initiated with social work and community partners. Then in 2019, a specialized program for Parkinson's disease was developed by our neurology leaders. Most recently, we have the establishment of specialized units, such as the emergency department becoming a level 3 geriatric emergency department accredited by the American College of Emergency Physicians. Glen Cove Hospital Age-Friendly Unit, a medical unit focusing on these 4 M's. And in 2020, we hired a director of geriatric hospital medicine and are now focusing on education and geriatric competency training of hospital staff. I'm very proud of Northwell and Glen Cove Hospital for all of its efforts to provide the best care possible for older adults, advocating for and providing the right care at the right time, and linking individuals to specialized care throughout the health system, in the community, and across the transitions of care. This is especially important as we are still in the throes of COVID-19. Older adults and their caregivers remain at risk. Like the virus itself, the resulting fear needs to be managed. Unsurprisingly, the group with the highest risk for complications and mortality associated with the virus are older adults and those living with serious illness. Also not surprising is that they've been among the most impacted by the surrounding stress associated with COVID-19, the loneliness and isolation. As we enter the winter of 2021, there are some things you can do to keep you and your loved ones safe. The 3 W's: wear a mask, wash your hands, watch your physical distance. That's 6 feet. This is not for us as individuals, but for the most at risk and to support our healthcare workers and healthcare system. Support, call, and connect with loved ones and visit responsibly and safely. If you go shopping this holiday season, take advantage of caregiver and senior hours to avoid crowds. Try to get prescriptions in bulk to minimize the number of visits to pharmacy or to see if they can deliver. And if you have a doctor's appointment, call and see if you can have telehealth, the telehealth option. But the best advice is to use common sense. If it doesn't feel right to you, don't do it. I, with Northwell and our healthcare partners, will be advocating for the distribution of vaccines, access to new treatments, and to the most at risk, including this population and our healthcare workers. Advocating for staff and residents at skilled nursing facilities and across a continuum of care to have access to vaccines, personal protective equipment, and treatments. I look forward to studying the impact of our initiatives and efforts and replicating them further across the region, our health system, and with Congressman Suozzi's assistance nationally. Glen Cove Hospital will be at the forefront of our health system and the community in promoting health. Thank you.
Thank you, Dr. Carney. And representing Glen Cove Hospital, I want to say thank you to really the recognition as a center of excellence and instilling the competencies, the education, training, and research that is required to keep enhancing the level of care for our aging. So again, thank you for that wonderful designation. I'd now like to introduce a true friend to Northwell Health and to Glen Cove Hospital. Prior to becoming congressman, he was the mayor of Glen Cove Hospital. I'm sorry, of Glen Cove, and is a native of Glen Cove and has cared for his family and his parents within Cove. He was also the Nassau County executor, and where Dr. Carney was the Commissioner of Health. And I think their commitment, as she mentioned, goes back a number of years to keep improving the care of our patients and of anyone that is within the environment for improving practice at Glen Cove and within the metro area. Congressman Suozzi is from the day one I started at Glen Cove, he's a busy man. He made it part of his day just to come over and say hello. And I want to thank him for his commitment and for his friendship. Congressman.
Well, thank you very much, Carrie, and it's really a very exciting day. I want to start by congratulating Northwell Health. I want to congratulate Mike Dowling. I want to congratulate Dr. Carney and Carrie Scanlon. This is really a big day. There's two big announcements. Number one, that Northwell's been designated as an entire system as an age-friendly health system. That's very exciting news that in the whole country, this is one place that's been doing the work necessary with a lot of help from the people that I mentioned, especially Dr. Carney, to make sure that Northwell Health is making special attention of promoting health care for senior citizens. We've got a storm coming in our country. There are more and more seniors growing every day. As Steve Bello mentioned in his remarks, 84 million senior citizens in the United States of America. The population is going to be doubling. We have to give special care to senior citizens. The second big announcement, something I'm particularly excited about and have been advocating for many years, back to when I was talking to Dr. Maria Carney when she was Commissioner of Health of Nassau County when I was county executive, that Glen Cove is being designated as a geriatric center for excellence, a model for the Northwell Health system and the region and hopefully the country for taking care of senior citizens. Because we have to understand, seniors have different needs when they come in. I grew up in a house where all four of my grandparents lived in my home. Three of them were very, very sick. My mom and dad recently passed away. They were 95 and 93 years old. You know from your experience, when a senior citizen goes into a hospital system, they're scared already as it is about their health care, and then they got to worry about entering into this big, huge facility. They don't necessarily have their same local doctor that they're used to dealing with all the time, and they've got to figure out how to navigate that bureaucracy. In my parents' case, they were fortunate that they had me and my brothers and sister to help them through the process. But not everybody has that benefit. Senior citizens need special care when entering into the scary situation that is a hospital setting, because they're sick probably, and because of the fact that it's so overwhelming with all these big decisions that have to be made when they first get sick and all the way through to end-of-life decisions. It's very, very confusing. So for years, I've been trying to think of how can the Glen Cove Hospital remain a viable, vibrant center, and what would be the best place for it to focus on. And geriatrics makes a lot of sense, especially because of the fact that it has a history of being a rehabilitation center. We'll hear a story of Mr. Prokop later today about his experience at the Glen Cove Rehab Center. But also because of the other services that are provided there related to Parkinson's, and you'll be hearing more about other age-friendly services at the Glen Cove Hospital. Recently, in legislation that was passed in Congress, I had language submitted that mentioned in an appropriations bill related to HHS, geriatric centers of excellence. The committee is concerned about demographic challenges driven by an aging population. The committee directs the Secretary of Health and Human Services to submit a report within 180 days of enactment of this act about how to create the most effective and efficient models for geriatric centers of excellence, which would serve as hubs to provide integrated and holistic supportive care for the aging population while monitoring and maintaining performance of the community's elder care arrangements. The report should address issues of how these centers will engage in clinical care, as well as provide an array of services and supports to make a community living possibility for more elders. The report should focus on how a cohort of local geriatric centers of excellence could be used to test and disseminate best practices. Moreover, the report should examine the benefits of establishing geriatric centers of excellence in a variety of settings, including urban, suburban, or rural areas. We have the chance to make Glen Cove's Geriatric Center for Excellence a model for the nation, and I'll do everything I can to help support this Geriatric Center for Excellence in Glen Cove. Glen Cove is so important to me personally. As I mentioned, or as Steve mentioned, I was born at the Glen Cove Hospital, but much more than that, my mom served as an operating nurse at the Glen Cove Hospital. My father served on the board of directors long after he had been the mayor of Glen Cove. I was the mayor of Glen Cove as well. All of our 3 children were delivered at the Glen Cove Hospital. I can't tell you how many times we've been to the emergency room for stitches, for getting banged in the head or broken limbs. So Glen Cove Hospital is so important to me. And when I brought my parents there in their twilight years for services, I observed the different challenges that senior citizens face. And that's why I know that for you and for your family and for so many people, creating a geriatric center for excellence at the Glen Cove Hospital will help to provide a model for what we need to do to help senior citizens navigate this very difficult challenge that they face in their lives, entering into a hospital setting when they're scared, when they're afraid, sometimes when they're alone. So I'm so grateful to Dr. Carney for her advocacy for this for so many years, for Dr. Scanlon, for Carrie Scanlon, I should say, for her work that she's done to lead this at the Glen Cove Hospital, and to Mike Dowling and his entire Northwell team for making this special designation of Glen Cove Hospital. So I'll do everything I can in Congress and as a resident of this area of the North Shore to do everything I can to help this project succeed. So thanks very much to everyone at Northwell. Thanks.
Thank you so much, Congressman. What better commitment than to hear that from national legislation and also local commitment and advocacy. Also, Congressman Suozzi mentioned regarding a special rehab program that we have at Glen Cove Hospital that has really taken off, and that is our Parkinson's program. It's the first structured rehab program in the nation where patients are coming from home and are able to focus on things that they want to improve and also to regain some of the dignity that they have felt they have lost in relation to some of the things that they, whether it be a physical ailment or a speech ailment. This program has been spearheaded by Dr. Suhail Najjar, that Dr. Carney had mentioned, the partnership with neurology, and Dr. Alex DeRocco, a national and international expert in Parkinson's. So we're very excited about that being added to one of the things that makes Glen Cove really be a wonderful choice for a center of excellence. Now we'd like to hear from really two individuals that I think when we're speaking about care, it's nothing better than to actually hear from the patients who've experienced it themselves. Our patient is, and he's no longer a patient now, he's actually been discharged, and we're so happy he's doing so well, is Mr. Ron Penzeck and his wife, Bonnie. Mr. Penzeck actually succumbed to COVID-19 and was in North Shore University Hospital in one of our intensive care units for about 2 months. Dr. Yu Kaseri spoke much of Mr. Penzeck and the commitment and the passion his family and he had for getting better. He was quite ill. He was on he was trached. He was on a vent for a number of weeks. And he experienced really a neuropathy that many of the patients that experienced COVID-19, in fact, we opened a separate COVID rehabilitation unit after patients were discharged from the ICU. He came to Glen Cove and was one of those patients. He had tremendous, tremendous weakness on his legs and his left side. And he learned how to regain his independence. And I do want to mention, though, the thing that is so striking to me was his family's unbelievable passion and commitment. And this was through really technology. They couldn't visit him. And that gave, I think, as he said, the strength and the will to keep fighting this disease. Without further ado, Mr. Panzok and Bonnie.
Thank you very much.
My husband, Ron, is one of the lucky ones.
Yeah, hi. I was in Glen Cove for rehab, and I must say I got very good service. I want to thank especially Dr. John. She really took very good care of me. When I was too weak to eat even, she was sitting next to me and feeding me. I told her, "Doctor, what are you doing? You have more important things to do." She said, "No, I want to make sure you're eating." She was excellent, an angel. And physical therapy, I forgot the name, it was Anthony and another lady that really I couldn't walk, I couldn't lift my left arm, and I'm a lefty. But they brought me from zero to where I am now. I want to thank them for all that they did for me. And it was a pleasure. The food was excellent food, and everything was, I had a very good experience there.
Like I said, my husband is one of the lucky ones. We would really like to thank the Northwell Healthcare System and Dr. Yu Kaseri, Chief of Critical Care Medicine, and as my husband said, Dr. Sylvia John, Physical and Rehabilitation Medicine from Glen Cove Hospital, and all the therapists there. All the therapists were really great. Everybody went out of their way for him, and we couldn't have asked for more. Like Kerry said, she gave you a little bit of background. My husband went into the hospital in March, and that was the exact day that they stopped allowing visitors into hospitals. And needless to say, we all flipped out. I mean, it was such a scary and horrible situation for us. A couple of days later, he was in a coma. All I could do was call the hospital multiple times a day. I drove everybody crazy. I wanted to know every medication. I wanted to know every test. I wanted to know what they changed, what they moved him, what they did. I mean, I drove them crazy. You know, then he was put on dialysis. I said, did he get the dialysis? How long was the dialysis? I just, all day long, all I could do was call. All we could do was network with my daughter's friends to find out if this was the proper care and to make sure he was getting everything that he needed. Northwell is so deserving of being recognized as an age-friendly healthcare system, and I can tell you why. I mean, my husband, like Kerry said, was in a coma for 2 months, and it wasn't until he was given the tracheotomy that he was able to come out of it. About a week later, he was transferred to Glen Cove Hospital for rehabilitation. His left arm and his left leg were not working. He was terrified, being that he's a lefty. They were very comprehensive there. When he got there, right away he was fainting during the physical therapy. They had to deal with that. They had to deal with his blood pressure dropping. They had to deal with other issues and get everything under control before he could even, get back to the rehab. Again, not being allowed to visit, I was going crazy, calling them all day long. What happened? Did you do this? Did you do that? Everybody there was quite kind, really, really sympathetic to me, and did the best to assure me that things would be okay. The quality of life is so important, and Northwell recognized that. We were worried his left side would not improve. I mean, they encouraged him and they told him that his left side would get better, and they showed him how to start walking again. They assured me that they were doing everything that they can, and that he would get better and he would start walking again. He did so well. They helped him physically and mentally. He did so well that they actually asked him to go into another patient's room who was really depressed, and to tell him his story and to show the patient how well he was doing, and that he could get better too. That shows that Glen Cove is really interested in doing whatever they can to help their patients, not only physically, but mentally too. Before his discharge, I got a call that I should come in to see, how he was doing. And they would like to show me his exercises and things to do with him when he gets home. They took the time to show me the exercises and what to watch out for that he shouldn't get hurt. They showed me and him how to get in and out of a car, and how to, just basically make sure that he had a safe experience. This shows me that Glen Cove involves the family and took the time to thoughtfully plan his discharge. They wanted to make sure that he continued to get better even after he got home. And to sum it up, family is the most important thing to us. We just spent a wonderful Thanksgiving together, and we look forward to Hanukkah and our miracle that Ron is alive, thanks to Northwell's expert care. Thank you. Thank you so much.
Thank you so much, Mr. and Mrs. Penzeck. And you are looking fantastic. You're doing well. And thank you for those lovely words around the care at Northwell. It is really an honor next to introduce Dr. Mayte, who is from the IHI. We have partnered with IHI in our health system over a number of years. And it is so important working with IHI on the age-friendly initiative. And I now would like to introduce him to say a few words. Dr. Mayte.
Hello there. My name is Kedar Mate, and I'm the President and Chief Executive of the Institute for Healthcare Improvement. I'm delighted to be part of this much-deserved recognition and celebration. Amid this pandemic, which we all know hit Northwell particularly hard, it's inspiring to see your continued commitment to improving care of all of your older adults. I join my colleagues in congratulating Glen Cove Hospital, Mather Hospital, Phelps Hospital, and LIJ Forest Hills Hospital for their recognition as age-friendly health system participants. Congratulations are especially due to the staff and leaders at Glen Cove Hospital, which is also being recognized as a center of geriatric excellence. Northwell Health deeply understands how to achieve care excellence. At IHI, we call it fostering a culture of continuous improvement, or as Michael Dowling puts it, being better tomorrow than we are today. This acknowledgement that excellence is a never-ending, continuous journey informs and animates all of Northwell's work, and especially its work to become age-friendly. You all demonstrate precisely what matters to older adults, their families, and their caregivers. A commitment to evidence-based care, reliably delivered to every older adult throughout your system. Your commitment and this recognition will inspire countless other facilities, health systems, and communities around the country and indeed around the world to see what is possible when all the elements of the age-friendly health system model are hardwired into standards of care delivery and performance. On behalf of everyone at IHI, thank you. Thank you so much for your continued collaboration in this work and in all of our work together. We are so proud, very proud of this unique and special partnership that we have together with Northwell. Thank you.
Hello, I'm Terry Fulmer, and I'm president of the John A. Hartford Foundation in New York City, a national philanthropy dedicated to improving care for older adults. I am thrilled to offer my congratulations to Northwell Health for its commitment to excellence in the care of older adults, and especially to Glen Cove Hospital, which the Institute for Healthcare Improvement has recognized as an age-friendly health system, and it's also a center for geriatric excellence. Northwell is one of the largest health systems in New York City, and it is an innovator and leader in the implementation of programs that improve health outcomes and the experience of care for older adults and their families. As we continue to grapple with COVID-19 and its disproportionate impact on older adults, age-friendly care delivered in an age-friendly health system is more important than ever. We thank Northwell. Well, what is an age-friendly health system? It's one in which the unique needs of older adults and their families are reliably met with evidence-based care, where no harm occurs. And it's a health system that goes beyond asking, what's the matter with you, to what matters to you. An age-friendly health system thinks about its patients as people and about care as a journey, starting at your kitchen table, maybe through your doctor's office, the emergency room, maybe an ICU or a long-term care facility that gets you back to your kitchen table. Age-friendly care is based on science and the best available evidence on how to care for older people as they continue to age. Northwell has excelled in this regard. They've adopted evidence-based programs to improve outcomes for older patients with hip fractures. Northwell is using a proven program developed at UCLA to make sure people living with dementia and their family members are well supported. Northwell is also creating geriatric emergency departments designed specifically for older adults. We salute Northwell for this deep commitment that is not only deep, but also has enormous breadth across their whole system. Leadership is key to creating an age-friendly health system, and Northwell has a shining example in its president and CEO, my friend Michael Dowling. He has led on many societal issues, from gun control to immigration. His system focuses on older adults, and in particular, those facing inequities in health care. It is an example for systems everywhere to follow. And Northwell's leadership doesn't just come from the C-suite. Dr. Maria Carney, a geriatrician, is just one example of the many outstanding clinicians who have led and inspired others to start age-friendly programs. And I would be remiss if I didn't thank Kathy Gallo for what she does at Northwell every day in her nursing leadership role. The John A. Hartford Foundation is a proud supporter of the Age-Friendly Health System initiative, and we, with our partners at IHI, are thrilled to congratulate and honor Northwell for its commitment to age-friendly care. It's going to be a pleasure to watch as you lead the country. Thank you.
Thank you so much for your wonderful remarks and for the acknowledgement and designation as age-friendly health system, and for the concept of an IHI constantly striving to improve what you have today for tomorrow. Dr. Terry Fulmer, thank you so much. It is an honor for work with your work and working with you and the John H. Hartford Foundation, and also through the niche program designations at many of our hospitals, and most recently Glen Cove. I remember you when you first started this. You were an associate dean at Columbia when I was a student in my master's, and then the way you spoke about the care then of the elderly, and the concept that you mentioned that it is constant, that it is not variable, and that is extremely important in terms of the competency and the care that which we provide. Thank you for your leadership and for your partnership with us on this, and for your acknowledgement. So that concludes the remarks this morning. We'd now like to open it up to the press for questions. And we'd like to say a special thank you to the people watching today via virtual Zoom technology. We know that this is a different platform, but it is so important to have this event. And I think that it works very well to get out to so many of you. So thank you for being with us today. Questions?
Thank you, Carrie. This is Jason Molinet on the Media Relations team. We have a number of people watching the live stream, and some members of the media have texted in some questions. The first one is for you as Executive Director of the hospital. Tell us about why Glen Cove Hospital is such a great candidate to be the first geriatric center of excellence.
It's a great question. Glen Cove, our focus is really on three main mediums. One is exceptional centers of excellence in surgery, particularly short-term surgery, ambulatory surgery. Second is our fabulous rehab program. And third is medicine. And when we look at Glen Cove, 20% of the nursing homes, the assisted livings, are within our back doors. It is a hospital like no other. There is such a friendly milieu and culture there for caring for one another. And it is our feeling, whether you are doing this in the age-friendly unit or doing this in rehab, or we are doing this for surgery, the competencies that we need to have and the caring need to be there in all of the elements. And we think that Glen Cove over time has made a huge commitment to this and will do exceedingly well. And next we'll offer more on Continuum, particularly with our partners, Kathleen Rice in the Senior Center, which is fabulous in Glen Cove, and many of our assisted and nursing homes within Glen Cove that we partner with. And last but not least, are programs that Dr. Carney is establishing with geriatricians in the private practice at Glen Cove. So that's some of the reasons why I think Glen Cove is an exceptional place to have this.
Thank you, Carrie. I have a question now for Congressman Suozzi. Congressman Suozzi, obviously, Glen Cove Hospital and Glen Cove in general is very close and near and dear to your heart. But given your role and given your lifetime of commitment to Long Island, tell us about the very real demographic shift that you're seeing that makes this a necessity.
I was born in 1962, so I'm the last year of the baby boomers. And every day we are seeing an explosive growth in senior citizens throughout the United States of America, and certainly here on Long Island. Long Island had tremendous growth in the late 40s, 50s, and 60s. Levittown was built in 1947. We went from 400,000 people in Nassau County in 1950 to 1.2 million people in 1960. So think of how many people moved here in the 50s and 60s and 70s that are now that much older. So we're having an explosive growth of senior citizens here in this region as a whole. Glen Cove, my hometown particularly, has a growing senior citizen population with 3 nursing homes in Glen Cove itself, 3 assisted living facilities in Glen Cove itself, several senior citizen housing facilities, in Glen Cove, and as was mentioned by Kerry Scanlon, an excellent senior citizen center and senior programs. The entire community of Glen Cove, from the city to the not-for-profit agencies to the housing facilities, working together with the hospital can create this perfect laboratory for trying to create this geriatric center for excellence. You heard about all the wonderful facilities at the Glen Cove Hospital already, with the long-standing rehab facility, with the new Parkinson's treatment, with this excellent work and the direction from people like Dr. Maria Carney as to how to make it more age-friendly, the new caregiver center that's being developed there right now as we speak. Tie those things at the physical plant of the Glen Cove Hospital with this amazing community support and this laboratory of senior citizens, it becomes the best possible location to create a model not only for the Northwell Health System, but for the region, for the state, and for the country as a whole. I'm so excited about this program, and I'm so excited that it's happening within my congressional district in Glen Cove.
Thank you, Congressman Suozzi. We have another question now. This one is for Dr. Carney. Dr. Carney, the question is, how important is it to have an age-friendly health system, especially right now during a pandemic, during COVID-19? How can this be impactful to that?
Sure. With COVID-19, we have seen that with each decade of life, a higher number of cases and hospitalizations and mortality. So we are seeing the impact on an older adult population. Age-friendly health system focuses on evidence-based measures, looking at the 4 M's: mentation, mobility, medications, and what matters most. All 4 M's are vital to be addressed when you are dealing with COVID. We're seeing older adults presenting with change in mental status, delirium, not a typical finding. We're seeing mobility being affected. We're seeing medications that have to be used to treat the illness, to prevent the inflammation, to prevent the clotting. All of these have effects on other illnesses an older adult may have. And what matters most, the other M, is having to make some serious decisions when you're faced with a serious illness. How to be cared for in intensive care unit or not. There are very difficult decisions, what matters most, and we as a society have to help advocate for the best care, and as Michael Dowling says, the right care at the right time.
All right, thank you, Dr. Carney. We have a few questions for the patient. Mr. or Mrs. Panzok, question for you is, can you please talk about any lasting impacts physically you've experienced from COVID-19?
Yeah, sure. I still have problem with my foot. I still have like neuropathy, and I feel like all the time I'm walking like on pins on needles, and I don't have like full uses of my foot. I cannot lift my foot, and this is the long effect of it. I'm going to physical therapy, trying to work it out, but it's still, I'm already, how many months I'm out of the hospital? Like 4 or 5 months, and it still didn't let go. I still have the problem with my foot.
He also has some kidney damage, but thank God he's not on dialysis.
Thank you for sharing that. One other question as a follow-up. You look great. Can you talk about the journey? Could you imagine being here today 6 months ago?
No, to tell you the truth, when I got up from the coma, I was very depressed. As I told you before, I couldn't move my left arm, and I'm a lefty. I wanted to brush my teeth. I couldn't brush my teeth. And I said, why they left me alive even? I don't want to be live like this. But slowly, I had the doctors, Dr. Kasseri, Dr. Ramani. Dr. Ramani used to come every morning and told me, don't worry, you'll be good, you'll be strong. And they really pushed me. And then in the rehab, they really helped me. I couldn't walk. When I was walking 5 feet, everybody made a big deal of it. And I used to work physically. I used to truck driver. I used to pick up heavy boxes and this, and it was very depressing. But slowly, yeah, with my family, my wife, my kid, my daughter, my son, they pushed me, and thank God I am where I am now.
Yeah, like I said, there were no visitors allowed. So it was really, really traumatic. We had thought that hearing would help. So when he was in the hospital in the coma, we had the nurses put the phone by his ear, and my kids and his brother and every extended family member would talk and sing to him for hours and tell him what was going on and just chat and chat and chat. Like I said, that was, you know, we didn't know if it helped or if it didn't help, but we thought that it could have some impact. And I drove them crazy with that. We would do that twice a day during the morning shift and during the evening shift. And as long as they would leave the phone there, that's how long we would stay on it, just doing whatever we can.
On behalf of Northwell Health, Mr. and Mrs. Panzok, Congressman Suozzi, everyone else who participated in today's press conference, thank you all for watching.
Thank you.